Recovering for a non-acute work injury. In general, the hand surgeon or plastic surgeon is able to predict what kind of therapy and recovery period a patient might need after surgery. In general, most surgeries will require 4 to 6 weeks of avoiding heavy lifting with the extremity, or in general to avoid separation of incision lines, to avoid damage to the surgery that's been done. Hand therapy can generally be first progressed with a gentle range of motion protocol and then into a formal range of motion protocol whereby a hand therapist is working on the hand or affected body part. The hand therapist will coordinate closely with the hand surgeon in order to determine what can be advanced in order to get the patient back to their heavy lifting protocol.